Welcome back. In today's sponsor spotlight, it can be a cosmetic problem or a serious problem. Vein issues impact many of us.
They do, but Dr. Tiff Siragusa has your back from forehead to foot. He's here to tell us all the ways that he's improved the lives of his patients. Welcome back, friend.
Thank you so much.
We are glad that you're here. I want to start with something that may look scary, but you can easily treat it. Forehead veins.
Yes. So forehead veins are one type of facial veins that we treat. A lot of people have bulging forehead veins that they really notice most when they smile or take pictures. They also become really prominent after exercising or being out in the heat. And so the treatment that we do is we're one of the few centers in the country that offers any kind of treatment for these veins. But we inject it with the medication that seals the vein off. To keep things safe, we use the ultrasound to actually gain access to the vein. We also use the ultrasound to monitor where exactly the medicine's going to make sure it just goes exactly where we want it. Afterwards, the patients have a little bit of tenderness in the area of the treated vein. That goes away in about 2 days, and then the vein really shrinks up to a little cord of scar tissue after about a week.
Oh, nice.
Yeah.
So how do you know if it's cosmetic or something more serious?
Forehead veins are almost always cosmetic. There can be other things that can cause veins to pop out in the face and on the forehead, but those would be more structural things, like if someone had a cancer or something going on in their neck where it was blocking the vein's ability to drain the blood out. But for the most part, the patients that are seeking treatment for forehead veins, they're young, they're healthy, there's nothing really going on. The veins only stick out really when they smile or hold their breath, and it's pretty straightforward cosmetic issue, yeah.
Okay, speaking of straightforward, we have an awesome before and after. We said forehead to foot. Look at this foot vein. Explain what you did here and what's going on.
Yeah, so with varicose veins of the leg, really all these problems start with problems with the valves. And the valves are what keep blood moving up. Veins drain blood out of our legs, and the valves are what allow the veins to fight gravity, which is trying to pull the blood back down. Now, in any particular vein, if the valves go bad or they reflux, which is what they call it, where they just flop down, well, then whenever you're standing or sitting, gravity wins, and now it pulls the blood down and stretches the veins out below it. So for the foot veins, we do a combination of injections and then make tiny little needle holes in the skin over the most prominent ones and remove them under local anesthesia. Those procedures take about 7 or 8 minutes in the office.
Amazing.
Yeah.
Quick and
that is
easy.
quick.
Yeah.
Sorry, something's got my throat. You can also see them on your thighs, though, sometimes, right?
Yeah. The thigh veins are a little bit easier to hide, especially during the summertime. People want to wear flip-flop sandals or just nothing on their feet. So the feet were really popular this summer. Thigh veins are also a very common area. The outer thigh is one of the more common areas people get spider veins and varicose veins. And that photo earlier was demonstrating some varicose veins and spider veins all treated in one session.
Wow.
Yeah.
Okay, question. This is safe, correct?
Yes.
Because I mean,
very
we have
safe.
so many veins in our body. How exactly are you working with these patients?
Yeah. So the way I try to explain it is that when we're born and before anyone develops vein problems, all the veins in your leg, they're working, they're doing their job, which is moving blood up. You don't even know they're there, like parts of your car when they work properly. And once a vein pops out and you start having pain or swelling or any issues with varicose veins, that vein is no longer helping the overall situation. So when you remove these veins or seal them off, you're not really getting rid of a healthy, contributing member of society in the leg. You're getting rid of a delinquent.
Okay.
You're getting somebody that's undoing all the work.
What a way to put it.
Yeah. So people ask all the time, though, how many veins can you treat? And it's like, well, we're really not treating a functional vein. We're actually getting rid of a problem is the way to look at it.
Okay.
Well, before we let you go, we have to talk about this new state-of-the-art building you guys got just down the road in Hermitage.
Yes. So we moved about a month ago, just getting settled in now. But the building is beautiful. It's brand new. A lot larger than our other office. Parking is much more convenient at this location. There's a covered area to get dropped off on days like today when it's raining.
Very good.
So it's been very convenient. Patients have really liked it.
You're celebrating with a deal for our viewers out there.
Absolutely, we are. $100 off any treatment done in the month of September or October.
Very good.
Congrats.
Dr. Tiff, thank
Yeah.
you so much.
Thanks,
I
Liz.
appreciate you.
Thank you, guys.
If you have veins that you want to get checked out, Dr. Siragusa is the guy. Visit NashvilleVeinCenter.com to get your consultation today.